Hi, this is Dr. Antolak from thegentlendentist.com. We are on 22 Mile and Hayes in Shelby Township, Michigan, right on the border of Macomb County, Macomb Township, Michigan. And I wanted to discuss today a little bit about some pretty interesting things we've been using for a few years, but it becomes very kind of new to people who are not aware of the technology that's out there. And that is what's called a cone beam CAT scan. The problem is CAT scan, the name CAT scan implies there's a lot of radiation that comes along with the three-dimensional image. This, for example, is basically a three-dimensional panoramic X-ray. The radiation on something like this is so very low, it's about equivalent to taking a set of X-rays. It's even less than taking a set of regular X-rays. And the information that we can glean from it is pretty incredible. It gives us the ability to look three-dimensionally at a patient, at their chart, and it gives us the ability to also virtually place dental implants. For example, in this patient here, I put a virtual implant inside there, and I actually mapped out where the nerve is. The benefit of using this type of technology is that we can see, for example, when we want to look and see the different levels and angles of the way teeth are and the way that the jawbone is, as we can see right here, we can see kind of a cross-sectional view of an arch. We can see all the anatomy and things like that. And with this type of software, we're able to use that and then send information, so we can create what we call surgical guides, which are little devices that snap over the teeth and allow us to just basically be very accurate with the placement of where actually the little holes go where the implant would normally fit and function. This is the type of technology that is necessary especially when diagnosing and treatment planning for implants. There are basically some areas of concern when we do look at that. One is probably the most area of concern on the lower jaw is the fact that there's a nerve that we highlighted here in the red. This nerve actually gives sensation to your lip and your teeth. And when we place an implant, it has to be plenty clear of that, or we risk the chance of having some numbness in the lip or something called paresthesia. On the upper jaw, what it also does for that is it will actually create our ability to find out where the sinus cavities are. So, for example, on this area on your top left side here, we can see where the teeth are right here at this region here. Now we're going straight up, as we can see by this little line here, and once we get there, we can see three-dimensionally, and then we can start seeing the sinuses. So you see these little dots here? Those are actually the sinus cavities that are in the upper jaw, and when teeth are lost, the sinus cavities actually start getting larger, which can create some issues with problems with placement and the size of implants. So this type of technology is wonderful because it obviously provides a lot of information. It helps us to stay away from vital structures that could create real issues and problems in the future. And this is the type of thing that you can expect at our office. We actually use this technology once again for implant placement, also for doing wisdom teeth extractions and the sort. So if you'd like to be part of this type of, not only just the technology, but the care that we provide and everything else, our office phone number is 586-247-3500.